Based on these preclinical findings, we launched the first phase 1 study. It was a dose escalation study investigating the safety and the preliminary clinical activity of intratumoral injection of 2141B11. It was a tumor agnostic study, so any patient with any type of cancer could be enrolled in the study. One of the main requirements was that they would have identifiable metastatic lesions either in the skin or in the subcutaneous tissue that would be amenable for the intratumoral administration. And this was given in a classic 3+3 expansion approach. It was a small study. The total number of patients that were ultimately enrolled in the study were 12 patients, and they were allocated in 4 different dose levels, all the way down from 0.7 up to 10 milligrams intratumorally, and the drug was given once every 3 weeks. And in terms of some of the highlights of the results, we found that our cohort was quite heterogeneous. We had patients with different malignancies, different types of breast cancer, different types of melanoma, as well as renal cell carcinoma. In terms of the primary outcome, which was safety, we found that it was very safe, the administration, very minimal treatment-related adverse events throughout all the dose levels. So there was no MTD within reach. And then in terms of toxicities of interest, such as cytokine release syndrome, thrombocytopenia, and liver toxicity, we didn't see any of that in any of the dose levels. And then in terms of secondary endpoints, which was anti-tumor activity, we found that in 6 out of the patients out of the total cohort, actually, we were able to see some reduction in tumor burden, including 2 patients with complete responses. So 1 patient at dose level 2 that was given at 2 milligrams, and then a second patient at dose level 10. Both patients had complete responses, not only the place that we injected the drug, but also in distal lesions. So I think one of the most impressive results was this patient with hormone-positive breast cancer who had metastatic disease in the axillary region, in the liver, in the lung, and then we injected the drug into one of the axillary lesions. And very quickly after administration, we saw significant decrease and pretty much elimination of the lesions that were in the axillary region. The patient was capable of gain mobility of the arm, and also significant shrunk in the lesions in the liver and the lung, which was pretty remarkable for a patient that had gotten, I think, up to 12 lines of therapy in the past. So it was pretty remarkable. And then lastly, in the correlative work, we were able to see that in those responding patients, we saw this significant immune infiltration in the post-treatment biopsies that resemble some what we call kind of germinal centers, these follicular appearing areas that now we know are tertiary lymphoid structures, which was also pretty impressive. So the first results in this phase 1 study really had allowed us to open other studies in tumor specific. So we have a phase 1 study in which we're giving 2141B11 intravesically in patients with non-muscle invasive bladder cancer. We just completed the first cohort of patients of 25 patients, and we're already seeing pretty good responses in a subset of patients. So we're hoping to, we're still waiting for follow-up on these patients, but we hope that the next year we'll have some results to be presented. We have just opened another study in collaboration with folks at MSK on intratumoral administration of 2141B11 in prostate cancer. And then at Duke, we have 2 studies in patients with malignant gliomas in which the drug is given intracerebral, and that's followed by perilymphatic injections as well. Still, the results we have to wait, but overall, pretty good safety signal. And then some patients definitely have pretty impressive responses. So very excited to see how that evolves. And then now we're in conversation with other groups. Head and neck would be a great space to implement this drug. We're very excited about the program.